Menstruation is heavy. Heavy menstruation, also known as menorrhagia, is a disorder in which the amount of blood shed during one menstrual cycle surpasses 80 cubic centimeters. This bleeding can continue many days and can happen 1 or 2 days before or after each menstrual cycle. Heavy menstrual symptoms. Heavy menstruation can cause the following symptoms. Changing sanitary pads every hour or less is recommended. The heavy cycle necessitated the development of many ways of protection. For more than a week, increased period bleeding. Inability to work out. Heavy menstruation, causes and risk factors. The following are some of the reasons for heavy menstruation. 1. What causes heavy periods? Heavy menstruation can be caused by hormone imbalances, fibroid-related abnormalities in the uterine cavity, myoma, endometrial cancers that are benign. 2. Potential dangers. The following groups are at risk. Female teenagers, women who have issues with their uterus, heavy menstruation complications. If the phenomena continues for an extended period of time, it may result in the following. Anemia, which is characterized by fatigue, shortness of breath, and impaired job performance. Severe discomfort, characterized by acute pain and cramps. Heavy menstruation is diagnosed. To determine the cause of excessive menstruation, the doctor performs the following tests. 1. Physical exam and information gathering from the patient. The doctor performs a preliminary diagnosis of menorrhagia, which includes gathering correct information about the length and character of the menstrual cycle, taking hormonal or other medications that may impact the menstrual cycle, and rejecting the possibility of pregnancy. 2. Gynecological checkups. A complete gynecological examination of the pelvic organs is performed, with the following being the most important. A pelvic ultrasound examination. Hysteroscopy, which allows for a direct examination of the uterine cavity in order to detect anomalies or aberrant symptoms within the uterus. 3. Additional laboratory tests. Blood cell composition tests, blood coagulation tests, and liver diseases and conditions that affect blood clotting are all indicated. Treatment for heavy menstruation. The menstrual cycle is treated by addressing the underlying cause, which may include hormonal treatment with medicines and situations of hormonal abnormalities. If the problem is caused by a uterine anomaly such as fibroids or polypi, one of the following 2 surgical treatments is recommended. 1. Hysteroscopy surgery. It is a procedure for treating intrauterine fibroids, endometrial polyps, or removing the uterine lining in cases of persistent bleeding following family planning, ablation. 2. The removal of the uterus. They are used after all other options have failed to stop serious bleeding. Heavy menstruation is avoided.